Banyak masyarakat yang marah karena harga masker itu tinggi banget sekarang. Dari yang awalnya Rp25.000 per box menjadi Rp300.000 per box. Even with influencers and Minister of Health saying that having mask does not decrease the chance of getting coronavirus, people are still on the hunt to find masks. I think the root of the problem is, 2. People's lack of knowledge of the purpose of masks and the fear of their life. People do not understand that masks are supposed to be used for people who have sickness that's easily transferable so that others won't get infected. Understand that it's for the sick and not specifically for coronavirus. I am personally not affected by the price change. It's not because I know masks gonna keep me away from coronavirus, but because I am ready. Think of it this way. Every year, I probably am sick of influenza twice a year, probably because of season change and people camping without giving a fuck about their surrounding. I am not affected by the price change whatsoever because I've always been ready with mask supply every year. I am educated enough to understand that when I'm sick, I know that the sickness can transfer to my surroundings. It's my duty to wear a mask. So with the current COVID-19 epidemic, I'm not wearing any masks. Why? Because I am not currently sick. My friends, knowing I have a good amount of masks available, tried to ask for some free masks. I declined solely because they are not sick. If they are, I would have given them a couple. So, judge yourself on this problem. If you don't have a mask supply, even when knowing influenza is so common, how are you not wrong for not having a mask available? Why try to find masks now all of a sudden? Okay, let's assume it's human mistake. After all, we always blame human error when we don't want to be blamed. For those who are on the hunt for masks at a reasonable price, is it ethically appropriate that you have a mask during an epidemic crisis? Isn't that the reason why the supply of masks are so low at the moment? Are you sick at the moment that you need a mask? Or are you trying to buy a mask because maybe you will get sick in the near future and you are trying to be ready? If you are not sick and you're trying to be ready, then in my world, you are wrong to do so because being ready is your responsibility in the first place. It's so rare that people emphasize that we are in a society that's always not ready. In my view, the people that are not ready is as wrong as those who are trying to profit from the epidemic, raising the price when the demand is high. I believe that they are not capitalizing on the crisis, but they are capitalizing on the people's weakness. They are making money because you are not ready. But hey, I am sure that most people that are on the hunt for masks aren't urgent enough to have one. So, what's my proposed solution for this problem? I believe the government has to intervene. At the moment, I can think one solution. The government has to intervene by monopolizing the mask market for a short period of time, at least until the epidemic shows better signs. The government has to monopolize in a way that forces the production of the mask is bought by the government and only sold in hospitals and clinics. This is to ensure that during this dire time, only those who deserve masks are the ones who get them. If you are sick, go to the clinic or hospital. If the sickness is easily transferable, then in my eyes you deserve a mask. But the hospitals and clinics should not sell or give by the box but by quantity. Give a couple of masks so they won't be abusing it by reselling. Be disciplined. Don't give extra masks because their kids are claimed sick. If they are sick, tell them to come to see a doctor to have some masks. Knowing how the government operates, I honestly am not confident in their choice. If you are not aware, during the Sulawesi Kalimantan forest burning, the smoke is so bad that it clouded cities nearby. People can't ride because visibility is so low. Do you know what was the government solution? They gave free masks to the people nearby, not knowing that mask has different purposes. They didn't know that the sick masks are not for smoke masks, and essentially they are just wasting money. So, what about doctor and nurse use masks if they're not sick? Well, because they are in very close contact for extended period with patients, so priority is to them. Having health care workers fallen left and right is much, much worse situation to be in for society as a whole. That means mask is work for non-sick person for preventive. Yeah, it does work preventively in close contact, therefore priority is to them because they are much more exposed to it in close distance. You're not performing intubation on patient, are you? Even droplets have limited distance to spread. Sure, if there is an infinite number of masks, by all means use that resource. But given limited number collectively, our society have to allocate to those who needs it the most first. Assume there is a limited number of masks due to production bottleneck and limited stock. For society as a whole, it makes more sense to prioritize masks for those with close contact to patients, because if all the doctors and nurses are dead, the hospitals are going to be overrun and people will die of other illness too, due to lack of treatment. Even if they didn't catch the virus, people having heart attack, etc., will die because nobody can treat them if the number of doctors available is slashed to say 50% of what we have now. Imagine all 250 million people wear 2 masks each day for 30 days. That requires a stock of 15 billion masks, just assuming this lasts for 30 days.